Hello, this is Dr. Andrew Fox. I'm a pediatrician with Huinape'olapono, and we're going to be talking about sleep today. Hopefully I don't put you to sleep with this. This is a picture of a child that is not in the recommended sleep position. What do we care about sleep for? Well, sudden infant death syndrome is a sudden unexplained infant death, usually less than the first year of age, really less than 6 months of age. And it seems to be related, at least in part, to sleep position. Also relates to things like prematurity and exposure to smoke, things like that. But what we're going to be talking about is the relationship to sleep. The leading theory on this is that babies that die from sudden infant death syndrome, it's related to rebreathing exhaled air, or essentially suffocation. They're not getting in oxygen and they're not getting rid of their carbon dioxide. When the oxygen level drops and the carbon dioxide level builds up, it causes a progressive shutting down of the brain so that you will actually become unconscious and go into a coma and eventually stop breathing, and your heart will stop and bad things happen. So if we can improve the sleep environment, the risk to the infant should be less. So back in about 1994, the American Academy of Pediatrics came out with a recommendation that babies no longer sleep on their sides or stomachs, but they really exclusively sleep on their back. And when that happened, the rate of SIDS, that was the whole category at that time. It's now a little bit more nuanced. There's several different categories of which SIDS is one. But at any rate, the infant death during sleep dropped way off. So it turns out that when the babies have exclusively sleeping on their back and not sleeping on their side or their stomach, their risk of death during sleep drops way down. Again, presumably because of suffocation. The other key ingredients are that the babies sleep by themselves on a surface that is firm, so they can't sink in, or they won't indent the surface, so not memory foam, not a water bed, not covered with sheepskins or things like that, where the babies can sink in and potentially trap the exhaled air and force them to rebreathe it. The other things that seem to be strongly associated with it are babies being overheated. So if the babies are wearing more clothes than they need to, or if they have garments on their face or their head that slip down and block their nose, throat, windpipe, that kind of thing. And again, the smoke. Those are all sort of key factors to prevention of the sleep-related stuff. So here's the prototype. Pretty boring, but the baby is by himself. He's not sharing a bed. Talk more about that in a second. He's on his back. The arms are not wrapped, so he's not swaddled. If there is a blanket, the edges are tucked in so it's not loose. There's nothing else inside the bed with him. There's no toys. There's no bumpers around the edge that, the old theory was it would keep the kids from sticking their head between the slats or getting their hand or foot stuck. They could twist or thrash around. And it's really not like the wrestling league. The kids are not flinging themselves around inside the bed and smashing chairs and things like that. They're usually pretty quiet when they're going to sleep. Although some. Okay, anyway. So this is the prototype. Boring, but there you go. We'll talk more about breastfeeding in just a minute, but even partial breastfeeding is helpful to lower the risk for SIDS. Plus, it's got numerous other benefits. So back to bed sharing. Especially for kids under 4 months, if they share a bed, if they're sleeping with parents or even one parent, their risk of SIDS is actually higher. So you really want the kids to be in their own place when they're going to sleep. And that shouldn't be a seated thing. It shouldn't be a car seat or a stroller or a swing. When that happens, the babies tend to slide down and their chin sort of, and their airway can buckle and they can have some impairment of their ability to breathe. For a while, the theory was that if the kids were kept semi-upright, it would make them less likely to spit up and have reflux, and then they could choke on that. Turns out that reflux is not associated with this at all, even in brand new newborns. So it's still that the babies should be flat on their back and not propped. The head of the bed shouldn't be up. None of that is really recommended at this point. If there are definitely things that make the risk higher for babies, and sharing the bed is one of those things, especially if one of the people sharing the bed is a smoker. Apparently there are some metabolites from cigarette smoke that can be transferred to the baby and do increase the risk for death during sleep. Especially if the parents are impaired, if they're taking pain medications or they had a few drinks, anything else that would impair their level of consciousness or ability to respond if the baby was in distress. Or if there's others besides parents in bed. Frequently this means other kids or pets even. It's like, no, the baby should be sleeping by themselves. Having the baby take a nap in a armchair or on a couch or a water bed or an old mattress or a dog bed or something like that, anything that's going to be soft and allow the baby to sink into it, that's going to be at risk. Extra pillows, extra blankets, mattress toppers, things like that, the baby can sink into, also at risk. About the overheating, in general, babies need about one more layer to maintain their body temperature than what an adult feels comfortable wearing. So if you're comfortable in a t-shirt, the baby needs a t-shirt plus maybe a sleep outfit like a onesie or something over top of that. But they don't need a t-shirt and a onesie and a hat and gloves and 2 blankets, and that's too much. Babies have a hard time removing that clothing, obviously, and if they're sweating, that's a signal of saying that they are too hot. If they're too cold, presumably they're going to cry and they'll let you know, because they're probably not going to fall asleep if they're cold. It's hard to fall asleep if you're cold. And again, about the garments on their face, not one of those, and not something that can slide down and get over their throat. You don't want that. Other questions that have come up. If you don't want the babies to sleep on their stomach, is it okay for them to have tummy time? Yes, it is, and it's recommended actually that the babies have some tummy time. But this is when they're awake and when they're being supervised. So if the baby is playing on their stomach, it actually improves their tone of their trunk muscles and improves their head and neck positioning. It strengthens them, and it's important developmentally. So tummy time is definitely fine. But again, it's while they're awake. It's not when they're sleeping, and they're also being supervised. The swaddling issue is some babies are real thrashers, and there are some startle reflexes that involve the arms flinging out and then kind of swinging back towards the face, and then a grasp reflex can kick in, and they can actually grab and pull at their face and eyes, and they're not going to be calm and ready to go to sleep if they've done that a few times. So swaddling will help restrict those arm movements, and some kids will calm down better when they are swaddled. You can only do that up to the point where they're trying to roll, because if a swaddled baby rolls onto their stomach or their side, then they're really much more at risk, because they can't use their body to try and correct their position or clear their airway. So swaddling only up to a certain point. Some parents have asked about whether it's useful to have a home monitor or an apnea monitor or an oxygen monitor to check on the baby when they're not in the room. You can have them. They're expensive. They tend to alarm and make you go crazy. And they don't reduce the risk for sleep death. So it's kind of a big investment for not much benefit. Likewise, some of the newer devices for breathable mattresses and things like that, there really isn't any evidence yet that they are protective in any way, but they definitely do cost a lot of money. A couple times parents have asked about whether immunizations are associated with sudden infant death syndrome, and actually the reverse is true. There's evidence that the babies being vaccinated lowers their risk for SIDS. It doesn't increase it. The smoke exposure we talked about, it's even, it's not just passive smoke, smoking inside the house, smoking inside the car, it's any smoke exposure. So you really want to avoid that. What about the kids that want to fall asleep in their strollers and swings? And that's the only place that will sleep, doc. So ideally what you would want to do is, if really that's where they calm the best, let them calm, let them get drowsy, transfer them to their bed before they fall asleep. That way they're making the transition to sleep in their sleep environment. It becomes familiar. It enables them to fall asleep and fall asleep again during the night if they partially wake up. If they wake up in an unfamiliar situation, they will fully wake up because it's not familiar. But if it's something that they're normally making their transition and falling back to sleep again, they'll do that easier, and that pays big dividends down the line when they're getting a little bit older. It is recommended that the babies sleep in the room with the parents, but not in the same bed as the parents, so that the parents can hear them, see them, immediate feedback if there's any signs of distress from the baby. After about 6 months or so, then you can think about moving the baby to a room down the hall, a place where the baby won't have necessarily line of sight vision, but you can still hear if there's a problem. And it makes it a little bit harder for the babies to catch a whiff of mom if they're breastfeeding. The smell of the mother can bring them out of sleep and entice them to wake up so that they can have an extra snack, which babies like, but usually the parents don't. So, okay, that was the bulk of my questions.